Hello, I'm Dr. Bill Owens, practicing chiropractor in Buffalo, New York. And thank you for joining me today to go through a very interesting case that I've recently had in my practice utilizing SpineCAMP decision-making software. So let me share my screen and let's get to the case. What we have here is a patient that was working at the Buffalo Psychiatric Center, and she was working sort of in the cleaning crew, and she was asked to move a tote that's typically filled with water. And she was told it was empty. But the truth was that it was actually filled with water. So she went to pick it up. It was at chest height. She wasn't able to hold on to it very well, and she fell back over and landed on her bottom. Now, what's interesting about this case is the surgery that you see here, one surgery had occurred before and another surgery had occurred after. But her pain level was still pretty significant. So this patient came to my office. Her workers' comp attorney had asked me to do a final evaluation. They were getting to the point of discussing whether this was permanent. And this had occurred on September 20th, 2022. And I saw the patient in March of 2026. So this patient was suffering with this for a very long time. She's probably 5'4", maybe 110 pounds, and just been in chronic pain and has never been able to return to work. So what I would like to point out is that this was both neck and low back, and you'll see in a subsequent case study, we'll go over her neck findings. But for the point of today, I wanted to focus on the back and the fact that globally she had 6 surgeries. She had 4 on her neck and 2 on her lower back. So when she came to me, it was very difficult for me just to, where do I start, right? Like what's the starting point? What's really going on in her spine? So of course, like any good evaluation, we want to see the motion of the vertebrae. And you can visualize this x-ray and maybe see some things that stand out to you. And we had her bend forward. Now, these x-rays were taken outside of my office. And what you can see here, and this is why I enjoy doing these cases, because oftentimes not everything's perfect, right? So there's always teaching moments on what SpineCAMP can do. That's a fully automated, AI-driven sub-millimeter measurement system. Nothing ever happens with that. Where we have errors is in x-ray physics or patient positioning. And you can see here clearly that she's bending all at the hip, right? This is pretty straight across. All of the motion is at the hip, but it is what it is. And SpineCAMP, luckily, helps to sort this stuff out when we have these little problems. You could see when she went to bend backward, not much motion at all. All these billowy visual findings here are all a degenerative change in arthritis. So let's take a look at the SpineCAMP analysis. And in this fully automated system, this takes about 60 seconds. We drop the DICOM in and we're able to see the geometry of this lateral radiograph. The magenta dots represent that geometry. But what's interesting now is that we can move through the various levels and we can see how they interact with each other. What's helpful for me in this is that these motion patterns are helping to support the direction that I'm going for my diagnosis. And if we get right in here and we start to look at how the spine moves, we can get a feeling for what's happening to this patient when she stands and bends. Now, one thing you'll see here is this green circle with an orange dot. This measurement has to do with how this L2 vertebrae rotates, meaning when it dips forward and dips back, is it rotating normal? Is the pin, essentially the fake pin, in that vertebrae where it's supposed to be? And does the vertebrae rotate around that? Now, you don't have to be an astrophysicist. All you have to know is that as long as the orange dot is in the green circle, we're good to go. But if we look at the L2 stabilized image, and we look at L1 moving on L2, and we look at L3 moving on L2, we start to get a feeling of what's happening in between these. And we also get a feeling of what's happening back here at the facet joint. And we could see that motion despite all of this pre-existing arthritic change. And what I do is I just simply move down. I move down to each level and I start to look. Now, my eye actually starts to see this doesn't look like a normal motion pattern. And lo and behold, SpineCAMP alerts me that the center of rotation is outside of normative data. That green circle is telling me that if we put a whole bunch of people in a room, which SpineCAMP did, and we measured all of them, and we looked at that motion pattern, this is where the orange dot should be. But we see her orange dot is outside that. So that's just a data point that helps me to think about what's happening with her. Now, even more importantly, when we go down here, we see that the dot is actually getting farther away. So as we move down her spine, what we're starting to see is she's getting worse and worse and worse. And what's interesting about this is that she's getting worse and worse and worse mechanically as she gets closer to the spinal fusion, right? So you hear things about adjacent segment degeneration, adjacent segment disease, all of these things, all of those biomechanical processes relate to that disease process, which means that the segment closest to the hardware is going to wear out next. And this is what SpineCAMP is telling me is happening, right? What we do about it is up to me. But we can see this motion is not really good, even here, right? And look at how far that dot is away from the green. Now, interestingly, when we zoom in here, the fused segment, that dot's spot on, right? Well, because this, first of all, this isn't rotating, but it was placed perfectly and then bolted into place. This isn't our concern. Our concern is what's above it, right? And in this workers' comp testimony, the reason this case is important to me is partially because of the anatomy and the pathology, but more importantly, this gave me so much strength and testimony to actually tell the carrier that there's no way that this patient is really ever going to be able to return to work, right? She's almost 60 years old. And these movement patterns are just truly aberrant. And SpineCAMP right over the surgical hardware, it sees through it. So it gives us accurate geometry. And we can see that even at the L5, S1 level down here, we are getting a little bit of motion. So there's a little bit of a pseudoarthrosis in here. But in terms of chiropractic and rehabilitation, this is my primary area that I'm thinking. So let's go to the report. What does it say? Now, as we get more and more familiar with SpineCAMP reports, we know that red is really bad and gold means we should take a look because it's not normal. And when you look at her levels, the red is indicating that this is beyond what impairment thresholds would catalog as a disability, right, as an impairment rating. And this is when she bends forward, her L3, L4 is moving excessively forward. And when she bends backward at L5, S1, her tailbone is moving excessively backward, excessively. This is where that pseudoarthrosis is at C5 or L5, S1. And the L3, L4 above that level is where she's getting a lot of this additional motion. And when we look at the gold, what we see here is she hasn't reached AMA threshold levels for a diagnosis of 25% whole body impairment in AOMSI, but she's pretty darn close. What her problem really is the instability at the fused level, L5S1, and the significant instability above that, right? Those together don't necessarily qualify for an AMA impairment rating, but these are disabling movements. And let's go through this one more time. And as I mentioned, this really helped me to testify really on her behalf. And this L4 on 3 is the bad actor right here. And this is the segment. So coming in for a landing here, my focus really is not on her having another surgery. She doesn't even want to hear that word ever again. But under workers' comp rules in New York State, I get to see her in a palliative manner. And everything that we're doing now is just to help balance the spine, relax the muscles, and relax the nerve impulses. And she's responding. So without this tool, I would not have known where to start. When you get data like this and you're able to really hone in on where the problem area is, it makes treatment and management fundamentally easier. So thank you for joining me on this. I hope this case gives you a little insight on how accurate and how important this SpineCAMP tool actually is. Thank you.